How you doing?
Good.
Awesome. All right. Well, thanks for letting us go review this stuff with you today. So I'm just was looking over your symptom checklist, and you have a lot of the symptoms, obviously, that are related to low testosterone. But of all of the symptoms on this symptom checklist, what are the ones that are really kind of bothering you the most that you're really hoping to have some resolution?
I'm mostly tired a lot.
Mostly tired a lot
throughout the day.
Okay, good.
Especially for my age.
Yeah, you're a young guy, and you own a business, and so you've got a lot of stressors there, and then have the 3 little ones at home.
Absolutely.
And yeah, all that stuff. Okay, good. So with your symptom checklist, every one of the symptoms on the symptom checklist is a testosterone deficiency symptom. Fatigue is the #1 symptom across the spectrum men and women complain about, and for men, the other thing that is a really big one for them is the ability to focus, and just the brain fog and the forgetting things and just not really being able to find words and things like that, which for guys like you, especially running a business, doesn't work really well. So we're going to go through all these labs, and we're going to talk about each different thing and what we can do for them. And then at the end, we'll talk about some of the options for your therapy and why I prefer one therapy over the other, and then we'll go from there.
Great.
Sound good? Okay. So, like I said, we get a lot of blood work out of the gate because fatigue is the #1 symptom that everybody complains of, and a lot of things can cause fatigue. Vitamin deficiencies, thyroid deficiency, testosterone deficiency, obviously. It's probably the testosterone. So your testosterone level is a 186. Now, there are no established normal ranges for men or women. As you can see, even on this lab, there's a reference range of 300 to almost 1100. So that's a huge range, right? So a lot of people mistake this range as a normal range, and it's not a normal range. It's just an expected range. But what we found in treating thousands of patients throughout the years is that men feel the best around 1000 to 1200. That is kind of the sweet spot. For you, being at a 186, that's really low. So I can imagine you do feel pretty miserable. The other things that go along with low testosterone like this for men is men tend to have, besides the fatigue and the brain fog and even sometimes anxiety, even sometimes moodiness, and some of the other things we talked about, a lot of guys complain of sugar cravings or just bad food cravings because your brain is trying to get what it needs somehow. And sometimes that shows up in the form of cravings as well. So I have a lot of guys that once they get their hormones, they're like, I'm not craving that 10 o'clock bowl of ice cream anymore, or things like that. And so it really helps with those efforts of getting back in shape. Men tend to be able to lose weight a lot faster, build muscle a lot faster than women do just getting their testosterone levels up. So I expect really amazing changes for you, just getting that 186 up to 1200 where you're going to feel the best. Now, one of the things that we get concerned about in young guys like you when their testosterone levels are under 200 is, do you have something going on in your pituitary gland that could be causing some issue? So we added on a test yesterday called a prolactin level because sometimes there can be what's called a prolactinoma, which is a little benign tumor in an area of the brain that causes some disruption in the hormone secretions. Your prolactin level was totally normal, so that's good news. But we just wanted to just rule that out to make sure we didn't need to send you for any follow-up. So this could be genetic, this could be stress related, it could be a myriad of things of why your testosterone is as low as it is at your age. I'm really glad that you're getting it checked out though, because you're too young to be this tired. The next thing we look at is estrogen levels. Your estrogen level is not detectable, and that makes sense because your testosterone is so low, because testosterone converts some to estrogen in men, and it's important. Estrogen is an important hormone for men, just like testosterone is an important hormone for women. Guys just don't need a lot of it, but you do need some. So I expect this to come up. The biggest thing we want to see in the initial is what is your baseline, and then when we check your post labs after therapy, we'll see what it gets up to. Your next one is a ferritin level. That helps us with seeing how with your ferritin levels being low. If they were low, that can play a role in your thyroid function, but yours are really great at 255. It's a great ferritin level. Most guys don't have low to eat more iron containing foods. Now, the next one that's elevated on you is your CRP. And C-reactive protein is, it's a general marker of inflammation, but when it is elevated, it can increase your risk of heart disease. So I really believe probably a lot of this CRP is just related to your low testosterone. You probably have, I would imagine, joint pain. You probably ache all over, I'm guessing, with that level, when testosterone is a really powerful anti-inflammatory as well. So it'll be interesting to watch this come up. The other thing that can cause a great deal of inflammation like this is diet and dietary. There's a lot of inflammatory foods that we eat on a daily basis, especially processed food, anything in a package, high sugar, high processed food, anything where you can't really read the words on the label. Those are all very, very inflammatory. So we really want to pay attention to this and work on some ways to get this down. I'm going to suggest a couple of supplements towards the end that will really help with that. That will be really good for you, and we'll watch that because it's a 7.0. It's pretty high. We want it below 3. So this is really one of those signs where it's a warning sign of your body going, hey, I am under a lot of stress and we need to make some changes or this is going to get bad. So really important, that one. The next one that's really low is a vitamin D. Your vitamin D level is at a 26. It needs to be above 60. Levels below 60 hold a 5-fold increased cancer risk and 160% increased risk of heart disease. When vitamin D and testosterone both are low, your risk for all cause of death goes up by over 200%, and your risk of heart attack goes up by about 140%. So these two being low together are no bueno. So we're going to put you on a prescription strength D supplement that's 10,000 IUs a day. Low vitamin D also can be contributing to this inflammatory thing. So you've got a couple of things that are not playing in your favor for heart disease, mainly heart disease. But we can fix them because you're young and you're going to bounce back really quickly. That's the beauty of being young. Your TSH that's a thyroid lab. It's a little bit elevated, but your free T3, which is the important one, which is the active hormone, looks okay for right now. We'll keep an eye on those and just see if after we get your vitamin D levels up and your testosterone levels up, and see if your thyroid levels out, because often it does. This is a metabolic panel. It's potassium, calcium. You know, we look at it as a baseline. It looks really good. Your vitamin B12 is on the low end. It's 220, very low. B vitamins are super important for detoxification, for brain health. It also will play a role in your energy levels. So I'm going to put you also on a B complex to go along with that vitamin D to take every day. That's going to be a super important one for you to get up there. The next one is just a baseline hemoglobin hematocrit. This is, we're just looking at your red blood cells and what's your baseline before you get your testosterone. So that looks really good. And then the last one is a hemoglobin A1C, which is a diabetes marker. When it's elevated above 5.6, closer to 6, you're really getting into that type 2 diabetes warning zone. You're still pretty good at a 5.4, so that's awesome news. You don't have that to worry about. So for all intents and purposes, I think just for you, your number one thing, obviously, is your testosterone. So like I was saying before, there are thousands of receptors for testosterone in the areas of our brain that's responsible for mood and thinking and mental clarity and focus and energy, right? So when your testosterone is really low, obviously you're going to have symptoms in that regard. My favorite modality is pellet therapy. I've done other modalities in patients in the past. The reason I love it mostly is because once we get your levels up to that 1,000, 1,100, it stays up for a good 4, 5, and sometimes 6 months. You probably won't last 6 months because you're young and stressed and blowing and going. The pellets dissolve based on cardiac output. So it's like licking a lollipop. The faster you lick it, the faster it dissolves, right? So these pellets are going to be placed in the fatty tissue, probably in your flank. And as they dissolve, the more stress you're under, the more you're blowing and going, the more you're running around chasing kids, doing everything you're doing, the faster they're going to dissolve. And so I would expect you're probably going to last no more than 5 months if you on the pellets. You'll know when it's time to come back because those symptoms that were relieved will start creeping back in. We definitely don't want you to get back down to 186. The best is to come back when you're just starting to feel the symptoms. That way you get your next round on top of the residual of the first round and you'll feel even better, right? Because now you've got a little bit left over that you're adding on some juice to, basically. Shots, not my favorite because they're synthetic. They tend to have a lot more side effects. You got to do it every week. So you're talking 52 shots a year versus 2 to 3 with pellet therapy. And the synthetic nature, it has a lot more side effects of estrogen conversion and some other things that guys don't really want. Creams don't work. It's not even really a conversation. They're expensive and they stink and they only will get your levels up about 100 points. That's not going to do you any good. So pellets are the way to go. And what to expect as far as side effects for men are very rare, if ever. I rarely have men complain about any untoward side effects at all. You can get a little bit of estrogen conversion. We don't really get excited about that because that's the body's natural way to do what it needs to do with the hormones. And estrogen balances that higher testosterone in men. We don't want it too high, so we'll be looking at it. We'll be asking you some questions at your follow-up lab to see how you're feeling. If it does get too high and you're symptomatic, which is pretty rare, we've got some medications and supplements that can help with that. What will happen after today is we'll get your follow-up blood work in about 4 to 5 weeks because I want to make sure that 186 got up to 1200. If you were underdosed, if you didn't quite get there, we'll bring you back in for a booster, which is where we just give you a little more. Sometimes when you're as low as you are, you might need a little bit more to get you out of the gate, but it's not very often that we have to boost. And then again, after that, it's all on you. You'll know when it's time to come in. Your wife will know. Somebody will know. You'll just not feel quite as energetic. The symptoms are different for everybody. Some men, they start waking up in the night. Some men just kind of start getting that afternoon fatigue again, so forth and so on. But you'll know because it won't feel the same. It's brilliant that you and your wife are doing this together and getting on the same page together. The worst is when one feels great and the other one's still down in the pits. So it's just awesome that you're going to do it together, and you're just going to do really, really well. Before we move on to the next stage, I want to give you an opportunity to ask any questions.
Do you know what exactly causes it to drop like that? Especially in therapy.
We don't know. There's a multitude of things. It could be genetic. You could have a genetic predisposition. It could be just purely the stress levels. I mean, you're 32 and you've got 3 kids and you own a business. That's a lot of stress. And so you've probably been dealing with this for a decade or more, right? You know, and so that in combination with a poor diet, because we have so many hormone and endocrine disruptors coming at us from the foods that we eat, that plays a role too. We're seeing more and more young people, young men especially, come in their 20s with really low testosterone levels. And near as we can tell, just based on kind of the literature that's out there, we those of us that are really investigating it, diet seems to be the #1 issue. We just didn't see this stuff 10, 20 years ago when we didn't have as much of a processed environment. So if there's anything you can do for your boys is just to, out of the gate, get all the packages as much as possible out of their diet. Sugar is a big one too. It's very inflammatory. Sugar is very inflammatory. So it's probably a combination of all 3 for you. I know because you're stressed and you're, on the run all the time, and it's easier just to go grab, food that's not that healthy for us. But once you feel better, you're gonna want to eat better.
Sure.
It goes like that. So it's not a scientific answer, and I don't really have a good answer, but those are the 3 top things that we see.
Okay.
Good question. Okay, you ready to get started?
Yep.